Okay, thank you so much, everyone, for attending this first series of this Unitar telehealth webinar. Really, really appreciate it. So my name is Milton Chen. I'm the co-founder of VC, and my colleague, Dr. Annalicia, is where two of us will be hosting this session. I guess just before to get started is we've been actually working on this webinar the concept, I guess, for the last 9 months. We're super grateful to our partners, starting with Unitar, of course, the Global Surgical Foundation, the Stanford Global Health, and Health Tech Without Border. Of course, we're super excited. And the concept behind here is for the last for the last 3 years of the COVID, so pretty much telemedicine, digital health, we saw this explosion of adoption across the world. Of course, now that the purpose of this webinar is to think about, okay, what's next? Right now that everyone is doing digital health, doing telemedicine, doing video conference, what are the big impact things we're going to do in the next? Again, this is the purpose for this. Again, our goal is to explore the concept. What are the big key applications? What are the things we can break barrier? What are the future healthcare look like? Again, maybe I could turn my floor to Dr. Annalicia, and maybe you could share your thoughts.
Yes, thank you, Dr. Chen. Hi, everyone. Thank you all so much for joining us today. It looks like we have a fair number hopping on, so we'll give it another minute or two. But just to continue our introductory remarks, as mentioned, my name is Annalicia Pickering. I'm a physician on faculty at Stanford University, but I also have experience in international telemedicine. And as Dr. Chen mentioned, I'll be moderating with him today. And we are so thrilled to be starting off the series. Really, as he mentioned, our goal is to be bringing thought leaders from all different sectors, whether that's government, nonprofit, industry, or academia, to help us understand what the current digital health landscape actually looks like and identify what challenges currently exist, as well as what's being done to overcome those. And for those who are coming from teams that have digital health goals that they haven't actually achieved yet, I also want to make you aware of a course that we are building in conjunction with this speaker series, where teams are going to be able to come together with us to be able to utilize foundational technology to help build tech products to meet your specific needs. For now, though, I'm going to pass it back to Dr. Chen if you'd like to go ahead and introduce our first speaker. Thank you.
Thank you so much, Annalicia, in this. Again, we're really excited to invite Alex to come provide the opening remarks. Again, from the UN perspective, I can share his thoughts on the perspective of how the series, hopefully we can impact the world, again, bring a lot of really high impact technology and the thought leaderships into hopefully can impact your personal endeavor as well. Alex, would you like to join us?
Yes, can you hear me?
Yes.
Yes, indeed. And I am trying to open the camera, but I apologize sincerely. I am traveling at the moment, and it seems that for some reason it doesn't work. However, let me try and give you some remarks on why we are having this Breaking Barriers, Exploring the Future of Global Health Technology webinar. I would like to share two comments principally. Number one, this is part of a series that intends to focus on health technologies as a key component in the global push for universal healthcare access. And when I say so, I would like to also express in a more personal note that this is a big aspiration of all societies, that it is indeed something that the World Health Organization has spearheaded, but it's beyond that. It really goes beyond whatever the United Nations organization that I represent would like to do. It goes to the sentiment, to the need, to the aspiration of all peoples, developing nations, developed nations. It's something that doesn't escape us. So if you are listening, dear participant, I understand we have an audience from very many countries. We have to work towards universal healthcare access, and we do have great partners that are helping us in this endeavor. I would like to expand on that because particularly we want to understand how thought leaders see the use of technologies and technological advances to actually achieve that, to expand the current healthcare landscape around the world. As I mentioned before, this aspiration that the United Nations really is committed to achieve one day, it hopes that is something that can be seen in a holistical manner. We have adopted in September of the year 2015 the Sustainable Development Goals, the Agenda 2030 for Sustainable Development. And in doing so, in a holistic manner, again, we really hope that health is at the core of whatever it is that we choose as a nation, any nation, as the path forward towards progress. Progress doesn't happen if we don't have healthy citizens, if we don't offer universal health care access. But more specifically now, on this first session background, I hope that you understand that the title actually says a lot, dear participant. We are to explore the future of global health technologies in order to achieve these aspirations that I just mentioned. And in that sense, I would like to recognize very many partners of the United Nations and of UNITAR that will be with us. Several of the speakers, the moderators, will be introducing one by one. But they represent organizations that are also committed to do this. I was impressed of seeing the commitment of Health Tech Without Borders, of, if I may remember correctly, the General Hospital in Boston, Massachusetts, our colleagues that already spoke at the VZ, at Stanford Medicine Children's Health, and particularly from my perspective at the Global Surgery Foundation. The Global Surgery Foundation is an organization that we were very privileged to incubate within the UN, within UNITAR, that today is an autonomous organization, not-for-profit organization under Swiss law. And for us at the UN to believe that we should support wholeheartedly an organization like the Global Surgery Foundation, it goes without saying that we do so because we believe that they can indeed make a difference. So in the second part of my remarks, I would like to also invite you to think, dear participant, on why the future of global health imply technological advances. It has to be like that. In a world that is increasingly interconnected, health technologies have become a cornerstone in our collective pursuit of universal healthcare access. As you will know, their impact is multifaceted, enhancing healthcare's efficiency, extending services to remote corners of the globe, and ensuring secure sharing of health information. This being at the core is something that I'm sure will be discussed later. But all these innovations, you see, they foster care continuity and reduce medical errors, ultimately saving lives. I'm not saying that humans perhaps are less efficient than health systems that are very much focused on technology. I'm saying that we need both. The health professional, no matter the level, no matter the specialization, no matter if it is a small community clinic or a humongous major hospital in a capital or a metropolis, all of us need to rely on technologies. It is a sign of the times, and it is something that the United Nations sees as positive and that will always support as something that we should embrace. To conclude, in this first episode of the series, you will learn more about digital health initiatives to healthcare systems with limited resources, particularly those facing humanitarian crisis. A special thanks again goes not only to the panelists, but to you, dear participants that are willing to give us your time to hear what we have to say. And I would like you to go thinking that we need your help. The United Nations is definitely not capable of doing these substantial transformations or leading these substantial transformations towards better health coverage alone. We need the concourse, we need the commitment of everyone that believes that can make a difference, because in partnerships, we see the solution. With that, dear moderators, thank you again for helping us to inaugurate this very unique webinar on breaking barriers, exploring the future of global health technologies. It is my pleasure and privilege to be with you. Back to you. Thank you.
Alex, thank you so much for the opening remark. And that we're definitely very honored and also to be inspired by your vision and the framework you lay out. Really, really grateful for that. Now we're going to turn into the heart of this session. So, by the way, the style of this, maybe for the audience members, we tend to make this fairly interactive so that we can address your concern, the things you're most interested in. Please, we know there's some questions start flowing into in there. So, as the speakers present, so our format is we'll have a relatively short speaker format. You can get to hear their thoughts and background. So we go open up the floors again. So ask your questions. Feel free to start typing in the QA thing. And again, so Annalisa and I will be moderating the questions and feed them into the panelists in this. So we are so excited, honored to have Health Tech Without Border as our first during our planning sessions. One of the reasons we decided to pick them is one is, of course, if you read things like Dr. Jerome Lee, Mariana, Eva, the background, there's just amazing people in there. Again, I will not sort of bore you with the traditional reader. Their bio are so long that I could spend like 30 minutes just reading all their accomplishments. There's a thousand people in this. But one of the things I would like to share is, especially Dr. Jerome Lee, I met him for a couple of years now, just such a wonderful human being, not only amazing physician as a thought leader, and he worked just insanely. I text him probably 24/7. He'd respond within like 30 seconds. It's just amazing work ethics and that impact of just getting things done. Again, we're super privileged to have the Health Tech Without Border starting our first series. Again, now I would love to turn the floor over to Health Tech Without Border.
Thank you, Dr. Chan. That's very kind of you. Before we start, we did want to quickly acknowledge the incredible amount of pain, suffering, and anger currently, especially with everything that has gotten worse over the last week or so. We also know that, unfortunately, during these dark and difficult times, disasters and humanitarian crises seem to only come more often, faster, fiercer, and larger. And these are both man-made as well as natural causes. But I will say that I have a lot of hope, though, and hope that things will get better. From the working firm with like Dr. Chen, Dr. Pickering, and many others I know are on this call, kindred spirits. I really believe that there's this undercurrent of goodness and humanity and people wanting to support each other, especially during times of crises. I know I speak for myself, but I also speak for all of our volunteers at Health Tech Without Borders. I believe that we all do this because of a belief, right? A belief in service to our friends, our strangers, neighbors, communities that we don't even know, so that we can support each other during times of need. And what is happening now and has been happening, not just over the last week, sort of underscores the need for the webinar that we're having today and this series, right? This acutely dark period we're in. Technology allows us to better connect, both good and bad, as we see, but I do truly believe that the good will outshine the bad, of course. Well, thank you. Let me share my screen. And And so in the next, brief introduction, I'm going to go through a quick introduction of some of our work at Health Tech Without Borders. And then Eva's going to take over and talk a little bit about our mental health projects. And Mariana will introduce herself and talk a bit about our telemed programs. And then we'll go into the more interactive question and answer session. So from a pure Health Tech Without Borders side, we are a global nonprofit NGO that's focused on supporting humanitarian crises and communities and people with telemedicine and other tech-based solutions. And our why, I think, doesn't really need to be stated, especially for this group, right? We do know that the number of disasters only continues to go up over the years. And the amount of money and economic cost for recovery especially, continues to be massive and continues to increase, with many communities not being able to even fully recover. And those numbers actually don't even include man-made disasters and conflicts that are all across the globe. Those numbers only included natural related disasters. But I do believe from the Health Tech Without Borders side and why we do what we do is really this picture. This is one of our mental health specialists that we work with closely in the field, who we support with services. And what's striking to us and to me especially is she's on a laptop that is fully equipped with technology and in a region where there is no power. And that's why she's using candlelight with no infrastructure, but still continues to support and take care of her patients and continue her important work. And that's sort of the world we live in now, where the technology we have, right, has really allowed us to do things that were impossible even just 5 to 10 years ago. That makes it very, very possible, especially in healthcare and improving access to healthcare and reducing inequalities. So from a Health Tech Without Borders side, we are here to connect people in crises. And we define crises very, very broadly, where it could be conflict affected, climate affected, to even just a crisis of the standard day of people in areas with no access to healthcare. In the next, 40 minutes or so, we will be talking a lot about technology, but I just want to remind us all that the underpinning of all this is about the people in need, and the tech is there to really connect us all and doesn't really have to be high tech. We are currently supporting 8 countries, and soon we'll be starting up a program in Cameroon as a commitment to action with the Clinton Global Initiative. And I am happy to report that since our inception at Health Tech Without Borders, we've mobilized over 800 volunteers across 20 countries, completed over 200,000 consults, and provided over 1,000 hours of mental health support. And when we think about how and why and how to actually support, there is a process. In many ways, it's pretty straightforward and similar to many organizations, where we always will think and do a needs assessment that is focused on working with not internally just with us, but also with our local partners, friends, and also local NGOs in the region that are already working. We never want to add more noise and only want to add value. So we want to be sure what we do can actually support and not cause more harm. And we're looking to really we are completely tech agnostic, so we can work with different tech partners and bring in multiple pieces, sort of like puzzle pieces or Lego pieces that we can put together between medical expertise, telehealth solutions to EMRs to bring it to a local use case and solution that's needed. And so to illustrate some of this, I just wanted to go through a few quick case studies that we'll have more time to do a deeper dive during the question and answer. So first is after the start of the Russian invasion of Ukraine last year, unfortunately, we also were coming out of the COVID pandemic in many ways, and sort of saw that telehealth works well and can be scaled rapidly, especially in humanitarian crises and a worldwide pandemic. And so we put out a call to action, not knowing what was going to happen. And it was incredible what the international community came together with. 40 plus tech companies all offered their tech pro bono, as well as over 800 volunteers all volunteered almost immediately in a short time over from 20 different countries. And putting it all together, we ended up completing about over 62,000 consults to Ukrainians within Ukraine by about September of last year. And as you can see, majority of the cases were really around primary care. It wasn't the high-end trauma, anything else that was going to the hospitals and such. But as I think we all know that despite whatever event it is, disaster, there's an acute need to take care of the patients and people immediately who are injured by it. But what is also lost and sometimes forgotten is the sort of loss of medical infrastructure. And it's really the chronically ill and folks with, for example, diabetes or chronic hypertension that get sicker and sicker over time if they cannot get access to medical care or to their medications. We also deployed a medical chatbot that teaches how to put on a tourniquet. So I would think of it as if you ever taken a CPR class, it is very, very formulaic and systematic, where it's 1, 2, 3, ABC. And that's what we built into a chatbot on how to put on a tourniquet if needed. Similarly, we have a second module that's focused on the medical professional to help them with a few advanced techniques. And after us having this go live, I'm happy to report that this was a few months ago, where it's already responded to over 32,000 queries. We have also been working with different teams throughout, and with some partner NGOs, we were able to drop a container classroom that was fully equipped with technology, as you see, laptops, internet service, as well as power, AC, and heating. And the power has solar panels, as well as a way to integrate and plug into the local power grid. And as you can see, it's very mobile. This one was delivered to a rural nursing school in Ukraine to support their education. Lastly, I just want to mention that we're also working with augmented reality. This is the HoloLens. We are also working with the Blade 2, and there's different, gadgets out there to do this. And surgeons have been using these, as you guys know, for decades, or for at least years, where they could support each other in the operating room in real time, no matter what location it is across the globe. And we figured that we could probably use these to support amputees, especially with physical therapy, occupational therapy, and prosthetics, because it's a very high-touch field like surgery. So we've been working with our local MIT Media Lab with AI-based where you can actually watch a patient with a prosthetic walk down a hallway, and it could follow them and map it out and help us determine how to modify that prosthetic over time. And so lastly, I just want to say that, technology today in 2023 is pretty amazing, right? To the point where we can do a lot. We can improve access to care. And with the correct resources, whether it's our group or any other organization working in this field, I do believe that we can rapidly scale and help and support much more patients, especially in the healthcare field. And this is our incredible leadership team, knowing that we also have an incredible amount of volunteers behind us that are not pictured here. We would not have been able to get anything done without this, kind support of all these folks. And I will turn it over to Eva.
Eva, unmute yourself, please.
Thank you. How many times we've done this Zoom and I'm still forgetting to unmute myself. Thank you so much. So I was saying, thank you, Dr. Lee, and thank you so much for the opportunity to talk about our work. Mental health is a big component to what we do at Health Tech Without Borders. We do have several current projects, and I will talk about some of them. One of the biggest projects that we have is directed towards the supporting providers who are working in humanitarian crisis zones. They face unique and profound mental health challenges due to the demanding and often traumatic nature of their work. The need for people in healing professions is staggering, and the impact on people in need is hard to estimate. But quite frequently, the mental health providers and healthcare providers are also the victims of a direct trauma, and they are also experiencing the full impact of the disaster. So the rates of burnout, PTSD, and compassion fatigue are very high among the healthcare and mental health providers working in the disaster zones. And at Health Tech Without Borders, we believe that it's our duty to ensure that the healthcare workers and mental health clinicians working in crisis zones receive the mental health support they need and deserve. And I do want to say that it's not only ethical imperative, of course, but it also a strategic investment in the resilience and effectiveness of the host country healthcare system throughout capacity building actions, adaptation, and preventive interventions. Next slide, please, Dr. Lee. So that is how the Helping Heroes Heal program has been developed. The aim of the program is to support mental health clinicians and healthcare providers working in the humanitarian disaster zones. Helping Healers Heal is well positioned to address the mental health of those who are healing the wounds of others, be it physical or psychological. We developed a support system based on lessons from the COVID-19 pandemic and evidence-based interventions to prevent and mitigate mental health issues occurring in healthcare and mental health providers during humanitarian disasters. The issues like burnout, compassion fatigue, anxiety, PTSD, to name a few. But what is important is that we don't only address the emotional or experiential issues they encounter during the work, we'll also help them navigate through complex ethical challenges, such as feeling of moral injury, that are unavoidable in the morally imperfect setting of humanitarian disaster. Through telehealth, we are able to provide and continue to support mental health clinicians in Ukraine and healthcare providers in Turkey. As you can see, over 200 mental health clinicians participated in our webinars. 10 mental health specialists trained by Health Tech Without Borders currently provide peer-to-peer support through telehealth to mental health clinicians, to 40 local mental health clinicians. I do have to point out that 4 of the 10, as we call them, mentors, are local providers who felt the benefits of the program and expressed the desire to join our program and help their colleagues. In total, we have provided over 1,025 hours of support and indirectly made an impact on over 4,500 patients who were able to receive much needed help and care from clinicians who are supported by Helping Healers Heal. Next slide, please. But we also appreciate and understand that a great number of people might not be able to have direct and quick access to mental health providers. So this is sort of our second ongoing project. We are partnered with MindStep and Sora Union to create an interactive self-help app in the Ukrainian language that will be accessible with time to Ukrainian refugees outside and inside of Ukraine. The app is based on already existing mental health app developed by MindStep, but it has been significantly modified and revised to address the needs of Ukrainian refugees. In its current version, it is based on evidence-driven trauma-focused cognitive behavioral therapy for post-traumatic stress disorder, but it also will be able to assess anxiety, depression, and cognitive functioning. And as we develop the app, we incorporate typical themes and needs of refugees, as well as very important cultural specifics such as appropriate language translation, interpretation, and understanding of the terminology, and contextually based approach to mental health. So the content of this app is multimodal. So we will have psychoeducational information to increase knowledge awareness and of symptoms of anxiety. It also symptoms of anxiety, depression, or PTSD. It also has self-help techniques. We will also have skill training for symptom management. And in addition, a short-term self-test on each of the specific modules, including the one on post-traumatic symptoms, is developed to allow for automated tailored feedback regarding progress at any time. Interactive materials such as animated videos and audios will provide to maximize usability and interaction, and important information and phone help numbers will also be provided to the users. So we are very hopeful that this will have a significant impact on improving the mental health of Ukrainian refugees. And I do want to say in the end that addressing the mental health needs of people in crisis zones is paramount for their well-being and for the effectiveness of crisis response effort. Health Tech Without Borders will continue to support those who are affected by the crisis, those who are suffering and hurt, and those who are in need of restoration of their well-being, be it physical or mental. And telehealth is one of the venues to do this. We are committed to rebuilding and supporting the capacity to heal and adapt, and we are committed to supporting efforts to helping create conditions resulting in human flourishing even after the most devastating humanitarian crisis. Rihanna?
Yes. Good day, ladies and gentlemen. It's a pleasure to be here today and to share my and our journey at Health Tech Without Borders and experiences we went through. And my name is Mariana Iminahoeva, and I'm one of the co-founders of Health Tech Without Borders. And I'm responsible for the tech part and operational part of all our implementations and deployments. And of course, our main focus is to deliver different types and wide spectrum of digital health solutions to people affected by natural disaster, climate change, and war conflicts. And also as a digital health expert, I'm involved in several European Commission projects and policy groups dedicated to improving healthcare systems using information and technology. Thank you so much for inviting us and having us today.
Thank you all so much for sharing your insights and experiences with Health Tech Without Borders. The work you've done has been incredible, especially looking at how quickly you were able to mobilize and just the amount of help that you've been able to provide so far. At this point, I think we can turn over to the Q&A portion of the discussion today. As mentioned, please share any questions in the Q&A box. We already have a couple lined up, so we can go ahead and start with those. First, we have an anonymous question asking about healthcare technology advancement that seems slow in certain areas, but is growing. And they mention record management, eye detection care, and non-communicable diseases. Based on the time structure, they are wanting to understand how long you anticipate third world countries in the Caribbean will be before they're able to access such efficiencies. Perhaps, Mariana, do you want to try to answer that, given your background in
I can start
access? Sure.
Answering, yes. And first of all, I would like to mention that we actually have met several NGOs working in this region and also several groups focusing on delivering humanitarian aid and to support local communities in this particular area in Caribbean. And I think that these people, they have quite ambitious plans, including the digital health solutions. And I personally don't see any difference between the concrete geographical locations for deployment or any significant limits if we will work hard and identify the limits we have. And I think this is kind of more detailed conversation about the social determinants of health or of the local population, about the local infrastructure, and also about the readiness of health tech companies to bring their solutions. Because mainly at Health Tech Without Borders, we work pro bono with health tech organizations and companies, which helps us significantly decrease the budget of implementing these solutions for the local countries. So, for example, this is what we share in somehow inspire technical and medical students as the next generation, which will come to help us and to support the local communities that actually you can implement everything basically with zero money, having zero money, just by receiving donation as manpowers, as the knowledge from experts and willingness of tech companies to provide free licenses for their solutions. This is my general answer. Thank you so much.
Panelists, maybe if I could add a follow-up question to Dr. Annalisa mentioned is, so for example, on my personally, I know I've been to over 50 countries doing these in-field deployments. Also is you get this you can do a successful pilot, but when you do the full-scale deployment, you just tend to just like things fall apart. I think for the Health Tech Without Border, what at least I'm really incredibly impressed. You guys going from inception to full scale, the volume and impact is so impressive in there. I get based on the audience question, do you have some guidelines for suppose that here's a country in the Caribbean, and what are some big challenges or solution tips you can give them to again just actually do this sort of wonderful digital health solution versus like just get stuck in a pilot and can't really go beyond it?
Maybe I'll jump in for a second, and so I'll say that I think, having been in many of the countries in that region as well, I think that the technology in so many ways is already there, right? The cell phones, the computers, all that is available and around, that it's not really the technology side. And I'm hopeful, as like Mr. Mejia said, that technology is the future in so many ways for healthcare, that I think that it's only going to ramp up much faster to the point where it's going to be much more accessible, hopefully more open source, to the point where we can start doing this for records management, for AI eye detection, and all the things that we want to do in regions like the Caribbean and everywhere else. So I'm hopeful that this will come faster than we want. I do think that that will be a challenge too, because at least I know from as a physician, that trying to integrate new technology and doing new things can make it even more difficult, just because we're so good at getting things done and doing those tasks and finding workarounds because we have to for our patients.
Yeah, I think to Milton's point, thank you, Jerome. I think this touches on one of the key issues and why we wanted to put this webinar series together, because we are all facing these challenges in different ways. And I think, each unique situation is going to come with unique solutions to some extent. But in terms of the barriers that we're facing, I think you can break it down into kind of two key components in terms of the technology itself, being able to access those resources, as we've mentioned, and then the implementation side, which is where the funding and the sustainability question comes in. And I think one of the challenges that we've seen too is that there really isn't a good resource to access kind of best practices in this space and how to do this work. There are some documents that have been put out by groups like the WHO, but in terms of having an actual environment to come together and work and implement these and build these things, that is somewhat lacking in today's environment. And so I had mentioned at the beginning of the webinar that we are putting together a course to try to help teams build these resources more quickly. And so that is something to be keeping an eye out in the coming months. Because we recognize that this is an ongoing challenge and that there is a lot of interest from different groups around the world. Thank you so much for your question. Another question we have on expansion, expanding health tech without borders specifically to East and Central Africa, given the ongoing refugee crises in countries like Uganda. Perhaps Dr. Lee, if you want to start this one off.
I will. Thank you, Dr. Pickering. Yes, we are starting up in Cameroon currently and hope to expand to the wider region as soon as we can. We are slowly starting with our partners on the ground in Cameroon to start up a telemedicine service so that we can have Cameroonian clinicians and physicians start up in Yaoundé, the capital, to support the climate-affected refugees and rural austere areas within Cameroon, knowing that it is our first pilot in the region. And I'm hopeful that we'll be able to get this going and hopefully scale to the region and expand to other countries and areas across East and Central Africa.
Thank you. Another question, how is local tech infrastructure maintained given the challenges of conflict, geography, and tech literacy? And I'll put this to the group.
I will try to start to answer this very complicated and complex question. And I mentioned that there are many questions actually around the infrastructure, like a physical infrastructure. So that's why we put as the highest priority to have the local partner, usually when we're coming for the deployment in different regions, because first of all, it's really important to understand the local perspective, including the technical infrastructure, and also just to monitor the changing situation and to receive very quick feedback and to adjust our response. Yeah. So having people on the ground is still really important when you do the virtual healthcare services. So this is one thing. Another thing is that, of course, we cannot be responsible and to deliver everything, but we are very lucky because we have a lot of partners. You're always within the network, and this is one of the, I think, the aims of NGOs is to build a network of networks. Yeah, to always know the people who can support you with bringing these technologies, to bring satellite, to bring electricity, to who the companies or organizations who are specialized on exactly delivering this and doing the best job in this industry. So this is another thing which we do in Health Tech Without Borders, is to be sure that we have partners who can support us in these exact tasks. I hope I answered the question. Thank you.
Okay, thank you so much for that. I guess if I could ask a follow-up question on that. So often when you do these projects, right, there's like just a lot of maybe technology barrier right there. Do you have internet? It's a Starlink down, it's a cell phone reception. Is the thing, whatever, gadget, whatever thing, sometimes is very how much training do you need you guys operate in very difficult scenario? Like how, if, for example, if the thing require too much training, then often, again, you can do some pilot, but actually adoption is difficult. Can I ask, like, how do you guys think about maybe these very issue when you do these things? Is there things, maybe especially tips you can offer to the audience, like how they navigate, plan around things on these, just, all these sort of technology potential frustration piece?
Yes, I can try to answer based on our experience in Ukraine specifically, because we deployed 3 telehealth platforms within 2 weeks. And you should be really focused on providing very clear and short instructions to all participants, potential participants and stakeholders in telehealth and virtual healthcare services. By this, I mean specifically, it should be 24/7 support for healthcare professionals. Yeah, it should be the same instruction basically for patients. It should be like a video, text, step by step, how you work, how to use, how you can ask questions, how you can answer the question. So everything around using the telehealth platform. Another thing is when we work in the humanitarian crisis or disaster affected regions, it's about the mental health of patients. So yes, patients could have the high digital and health literacy, but being stressed, it's very difficult for them actually to provide the right information to healthcare professional to reacting in the correct way. And this is what we put also additional trainings for our healthcare professionals, how to work with patients having trauma. And thanks to Eva as well, because this is a part of the huge work we do in mental health to help and support first responders, including healthcare professionals. And Eva, probably you could add something here as well. Thank you.
No, I think you covered it very well. I mean, I think there's the importance of support and the importance of telehealth in supporting the mental health clinicians, the first responders, the healthcare providers is substantial. And of course, the cultural aspect is also very important in the way how we address whatever issues arise. I think, Mariana, you covered it quite well, the answer to the question.
Maybe I'll just jump in too. I want to underscore that, you know, this question by Peter Kaplan is really what it shows that it is very specific to the needs of that local event or population or whatever we decide to support. And right, and so every place, whether it's connectivity or less tech literacy, we need to figure those out. And it's going to be local solutions with customized solutions, knowing that we have different ways of bringing in global partners to go after and fix this challenge. But I think underscoring it all too is the sustainability piece, right? Is we can hobble and cobblestone a lot of stuff together to make it work. But I think the key is we don't want to just make it work, right? We need to be sure that what we have can be long-term sustainable to the point where that's locally, you know, built and essentially taken over, so that if we want to be able to leave, right, we don't want to be stuck, not really stuck, that's the wrong word, but we want to be sure that whatever we end up supporting can stay and continue supporting the local communities for the long term and add value to the area.
Thank you so much for the answers. We have another question from the audience. So, for example, how do you manage the licensures across different countries, right? So typically, Jerome, you're in the Harvard, how do you practice medicine in another country? And then also related to that is, what about the other regulatory issues as you operate across borders and so on?
Yeah, maybe I'll start with, and I'll say that, you know, this is probably one of the trickier ones, knowing that we are across borders without borders, like many of the NGOs, but we have to live within those borders. I'll say I am acutely aware as a physician in the US that we have 50 states with 50 different rules for different licenses I need to get to practice here. And so we work with, you know, the Minister of Health's office and the government and everyone else we need to be sure that we can do this properly by regulations and licensure before moving forward.
I guess, like, as you deal with this, again, is there like, I know a lot of the audience members, I think these are like a doer, right? They want to see that they inspire by what you have done, then replicate in their own country, in their, like, do you find like, it's like how painful is that? Can maybe like just like getting all the approval of various other thing, getting the government official, is that a significant barrier, or you find that it just is something could be overcome? And
Maybe Mariana, do you want to start, since I know you know this well?
Yeah, I think it's always painful. Answering your question, Milton, yes, it's painful, but this is actually what I wanted also to share as, let's say, as our experience, that you should push the implementation side. Yeah, you should reach the deployment. You should bring the place like a telehealth or any other digital health tool if your volunteers are waiting to help their communities or other people across the globe. And this was kind of our responsibility, time pressure. We experience implementing telehealth in Ukraine particularly because we wanted to give this tool for people who wanted to help other people. So we have a very high bar and very high requirements to our digital health partners, honestly. So we want to be compliant to the local digital health requirements. And moreover, we wanted to be compliant also with HIPAA requirements and also with GDPR rules for European Union. So initially, when we have this kind of big assessment of digital health tools, unfortunately, we will have to choose only certified solutions to bring them to the exact territories or countries. But I hope that at least our colleagues on the health tech space, they totally understand why we have these limitations. Because if you put so huge effort for deployment, it's a pity to stop working in 1 week. Yeah? You should put these requirements to, again, to reach this sustainable goal, yeah, and to give the local community the solution which will work for years. And this is our answer. I also liked a lot the question about language from one of our participants. It's a great question, because this is one of the big pieces of the assessment which we do before the deployment, to understand what are the languages the population speak, medical professionals in the local territory speak, because this could be a great limitation for deployment of anything. And also, if we bring technology, like, for example, Eva shared our project together with MindStep and Sora Union about the mental health application, the translation of the content should be contextually right. It should be culturally correct. And we put a lot of effort, honestly, like really translating and verifying with the core groups of potential users, testing, piloting, to bring best solutions, but also bring it in the most applicable and correct way. Thank you so much.
Is it okay to ask this, like, in a lot of times there's a lot of good people want to do good in there. At the same time, the regulatory could be a nightmare. In the case of emergency, do you know there any case? I guess what you recommend is okay to just do it, but ask for forgiveness later. Or you really want to advise them they should really get all the regulatory things taken care of before they have serve the refugees and so on.
I think we should start working, first of all, with the local ministries of health. And this is what we have been doing in all locations, just to understand how we work, what is the perspective, what is the vision of the local authorities. Because again, we want to help. We don't want just, to be there and, as Dr. Lee said, make any noise. And we want the solutions to be sustainable. So yes, we will need to go through this with authorization, certification, and all possible requirements. But it's still, this is what we want to share. It's still possible. Just, you need to keep working and keep doing and keep hoping that you will manage to deliver. Thank you.
Yeah, and also working with, especially if it's a disaster setting, with the clusters and the health clusters that are localized to support and better organize the resources as well.
I know we have enormous number of questions still pending in this, and unfortunately, we are coming down to the tail end of the hours. But one thing for the audience members, we will pass all these questions to the panelists, and we will produce an official recording of these, and plus we'll have their answers written down in this. Again, definitely, so we will get to all your questions. You'll find them online, posted soon. Of course, definitely we would love to invite you to share this recording to all your colleagues and so on. And maybe I will pass the floor back to Annalicia for maybe wrapping thoughts as we conclude.
Sure, thanks, Milton. So thank you all again for your time today. It has been wonderful bringing everyone together to just begin the conversation, because this is something that's going to take more than just an hour. Obviously, this is an incredibly complex topic with a myriad of opportunities, but also challenges. And we want to encourage the discussion. So thank you all for those who have shared questions today. We'll be hosting this webinar monthly, so please keep an eye out for upcoming speakers. At the end of the session, there will be an opportunity to provide us with some feedback on today's webinar session, also with a chance for you to share specific topics that you would like to learn more about in the scope of this topic. So please take a look at that. And at this point, I would like to just give it back to the speakers if you have any closing remarks. And thank you all again.
Yeah, maybe we can
Jerome,
use
would you
for
like
the
to?
panelists.
Go ahead.
Yeah.
I would probably, from Healthcare Without Borders side, again, thank you to all attendees for your time and your will, and I think your great interest in digital health and how these technologies potentially could improve the life of your local communities, your country. And I also would like to thank all our volunteers, our partners, also Milton and Dr. Pickering, you and Alicia, for moderating so wonderfully this session. And I hope that this series will be great, valuable information for all those who would like to really apply digital health tools to healthcare systems. Thank you so much for having us today.
Wonderful. I guess, Eva, Jerome, do you have any final thoughts to share?
The only thing that I would like to add, thank you so much. It was, it's a great series, and it's a great topic. And I do hope that we will be able to continue to discuss questions of telehealth, and of course, my favorite topics, mental health and ethics around telehealth. But until next time, thank you very much. Thank you all for coming.
Just want to say thank you as well. And it looks like we could have gone for another whole hour. Incredible questions. I know this is just the start of this conversation. So looking forward to the next webinar. Thank you all.
Thank you so much for all the panelists. One thing, by the way, so when Annalisa and I were thinking about planning for this, I guess even working with the UNITAR for the last 9 months, and we specifically want to pick panelists and speaker who are people that do things, right? These are very inspirational people. We're hoping that all the audience members, you guys become part of our UNITAR community. One of the things we would love to invite you is, as Dr. Annalisa mentioned at the beginning, so the course structure is there's a speaker series as you continue. Then there's a hands-on portion that'll be starting on early next year. The purpose of hands-on session is that we can work with you to build your own project within your country for your efforts in this. We are just starting out at January at the Stanford University. There's a class called Computer Science for Social Good, which will be European-based, getting students. So, for example, if you have university students who are interesting to participate with us, we would love to hold them in part of our global consortium. Again, we like the people who do things. And then if you willing to host a sandbox for the students, for project to be hosted on, definitely please contact us. We're always looking for people who can, again, so create that from on one side, people do stuff, other side, creating sandbox environment. We can actually pass out key concept. Like a thing for this about breaking barrier in there. And the final thought is, so technology has been rapidly is about amplifying what people could do. So, for example, I was at the IEEE humanitarian conference. I actually met even high school students doing this global impact work. Like, you don't need to be a PhD level with 10 years experience. And literally, if you're passionate about this, like a part of hands-on course, we're going to give you the tools, teach you how to do it, able to have these high impact. Again, with that,
And Milton,
please.
how can teams take you up on that opportunity to share ideas? What's the best way to get in touch with you?
I would say the best way to reach out just the panelists members. Again, we all work together. So my email just milton@vc.com. How about during the Unitar webpage, we'll post our contacts so you can reach out to us.
Perfect. Thank you.
Okay, with that, again, I just wanted to thank you, all the panelists member. Thank you, you at Unitar. Again, thank you for the audience member for joining us. Again, thank you so much.
Thank you.
All right. Take care, everyone. Enjoy the rest of your day.
Thank you so much.
Thank you.
Have a nice week. Bye.